Understanding compulsive disorder symptoms. Introduction. Compulsive disorders, commonly known as obsessive-compulsive disorders, OCD, are mental health conditions characterized by persistent, intrusive thoughts, obsessions, and repetitive behaviors, compulsions, that an individual feels compelled to perform. These disorders can significantly impact an individual's daily life, relationships, and overall well-being. Understanding the symptoms of compulsive disorders is essential for recognizing the condition and seeking appropriate treatment. This comprehensive exploration delves into the various symptoms associated with compulsive disorders, their impact, and the underlying mechanisms. 1. Obsessions, intrusive thoughts. 1.1 Nature of obsessions. Obsessions are unwanted, intrusive thoughts, images, or urges that repeatedly enter an individual's mind. These thoughts are often distressing and cause significant anxiety. Common themes of obsessions include fears of contamination, harm, or losing control. 1.2 Common obsessive themes. Contamination, fear of germs, dirt, or illness. Safety, fear of harm coming to oneself or loved ones. Symmetry, need for objects to be arranged in a specific order. Forbidden or taboo thoughts, intrusive thoughts related to religion, sex, or aggression. 1.3 Impact of obsessions. Obsessions can be overwhelming, leading to significant distress and anxiety. They can disrupt daily activities, making it difficult for individuals to concentrate, work, or maintain relationships. 2. Compulsions, repetitive behaviors. 2.1 Nature of compulsions. Compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession. These behaviors are intended to reduce anxiety or prevent a feared event or situation. However, the relief provided by compulsions is typically temporary. 2.2 Common compulsive behaviors. Cleaning, excessive hand-washing, cleaning, or sanitizing. Checking, repeatedly checking locks, appliances, or body parts. Counting objects, steps, or items repeatedly. Arranging, organizing items in a specific order or symmetry. Reassurance seeking, constantly asking for reassurance about fears or doubts. 2.3 Impact of compulsions. Compulsions can consume a significant amount of time, often interfering with daily functioning. They can lead to physical harm, such as skin damage from excessive washing, and can strain relationships due to the need for constant reassurance or the time spent on rituals. 3. Emotional and cognitive symptoms. 3.1 Anxiety and distress. Individuals with compulsive disorders often experience high levels of anxiety and distress. The intrusive nature of obsessions and the time-consuming nature of compulsions contribute to this emotional turmoil. 3.2 Guilt and shame. Feelings of guilt and shame are common, particularly when obsessions involve taboo or socially unacceptable thoughts. Individuals may feel embarrassed about their compulsive behaviors, further exacerbating their distress. 3.3 Cognitive impairments. Cognitive symptoms such as difficulty concentrating, memory problems, and indecisiveness are frequently reported. The constant mental preoccupation with obsessions and compulsions can impair cognitive functioning. 4. Physical symptoms. 4.1 Fatigue. The constant mental and physical exertion involved in managing obsessions and compulsions can lead to significant fatigue. Individuals may feel exhausted due to the time and energy spent on rituals. 4.2 Physical harm. Certain compulsive behaviors, such as excessive cleaning or skin picking, can cause physical harm. Individuals may suffer from skin infections, sores, or injuries resulting from their compulsive actions. 4.3 Sleep disturbances. Sleep disturbances, including difficulty falling asleep, staying asleep, or experiencing restful sleep, are common among individuals with compulsive disorders. Anxiety and the need to perform rituals can disrupt normal sleep patterns. 5. Impact on daily life. 5.1 Occupational functioning. Compulsive disorders can significantly impact occupational functioning. Individuals may struggle to concentrate at work, miss deadlines, or avoid work-related tasks due to their obsessions and compulsions. 5.2 Academic performance. Students with compulsive disorders may find it challenging to focus on their studies, complete assignments, or participate in class activities. This can lead to poor academic performance and difficulty maintaining academic progress. 5.3 Social relationships. Maintaining social relationships can be challenging for individuals with compulsive disorders. The need for constant reassurance, time-consuming rituals, and avoidance behaviors can strain relationships with family, friends, and romantic partners. 6. Underlying mechanisms. 6.1 Biological factors. Research suggests that compulsive disorders may have a biological basis. Abnormalities in brain structure and function, particularly in the orbitofrontal cortex, basal ganglia, and thalamus, have been implicated in the development of OCD. 6.2 Genetic factors. Genetic factors also play a role in the development of compulsive disorders. Studies indicate that individuals with a family history of OCD are at a higher risk of developing the condition. 6.3 Environmental factors. Environmental factors, such as stressful life events, trauma, and infections, can trigger or exacerbate compulsive disorders. These factors may interact with genetic and biological predispositions to increase the risk of developing OCD. 7. Comorbid conditions. 7.1 Anxiety disorders. Compulsive disorders often co-occur with other anxiety disorders, such as generalized anxiety disorder, panic disorder, and social anxiety disorder. The presence of comorbid anxiety disorders can complicate diagnosis and treatment. 7.2 Depression. Depression is a common comorbid condition among individuals with compulsive disorders. The chronic stress and emotional burden associated with OCD can contribute to the development of depressive symptoms. 7.3 Body dysmorphic disorder. Body dysmorphic disorder, BDD, involves obsessive preoccupation with perceived flaws in physical appearance. It is often comorbid with compulsive disorders, as individuals may engage in repetitive behaviors to address their perceived flaws. 8. Diagnosis and assessment. 8.1 Clinical interview. A comprehensive clinical interview is essential for diagnosing compulsive disorders. Clinicians assess the presence of obsessions, compulsions, and the impact on daily functioning. 8.2 Self-report questionnaires. Self-report questionnaires, such as the Yale-Brown Obsessive-Compulsive Scale, YBOCS, are commonly used to assess the severity of OCD symptoms and monitor treatment progress. 8.3 Diagnostic criteria. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, provides specific criteria for diagnosing compulsive disorders. These criteria include the presence of obsessions, compulsions, and the significant impact on daily functioning. 9. Treatment approaches. 9.1 Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is the most effective treatment for compulsive disorders. Exposure and response prevention, ERP, a specific form of CBT, involves gradually exposing individuals to their fears and preventing the performance of compulsions. 9.2 Medications. Selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed to treat compulsive disorders. These medications help reduce the frequency and intensity of obsessions and compulsions. 9.3 Support groups. Support groups provide individuals with compulsive disorders the opportunity to share their experiences, receive support, and learn coping strategies from others facing similar challenges. 10. Prognosis and long-term management. 10.1 Prognosis. The prognosis for individuals with compulsive disorders varies. Early diagnosis and treatment can significantly improve outcomes. However, some individuals may experience chronic symptoms that require long-term management. 10.2 Long-term management. Long-term management of compulsive disorders involves ongoing therapy, medication, and support. Developing healthy coping strategies and maintaining a strong support network are essential for managing symptoms and preventing relapse. Conclusion. Compulsive disorders are complex and multifaceted conditions that significantly impact individuals' lives. Understanding the symptoms, underlying mechanisms, and effective treatment approaches is crucial for recognizing and addressing these disorders. With appropriate intervention and support, individuals with compulsive disorders can achieve significant improvement in their symptoms and overall quality of life. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.